Hello, everyone, and welcome to this week's episode of the Auditing Antics podcast. So, today we're going to jump into our first topic, and we're going to be going over lab services. This really applies to diagnostic testing in general or procedures, which we'll talk about. But we're going to be going through and reviewing the specifics related to medical necessity and what that means. Obviously, we've got the two sides that we are going to be bringing into this with the coding and auditing, and then the consumer side. But one thing I want to cover first, Michelle, is the concept of medical necessity. This is something for those of us in the industry that is very subjective, and it comes down to really what's in the documentation. So, throughout this episode, when we talk about medical necessity, we're going to be referring to basically the reason why the testing is being done and what should be in documentation to support that. And I think that a lot of times this is something that is left out in the busyness of a practice. We will look at notes often and see just an order, for example, not really understanding the context behind what's going on, the discussion taking place, why that test is being ordered. And, Michelle, one perspective I would like to throw into this that we really didn't talk about yet between us two is the perspective of the lab as well. I've actually had multiple clients over the past 6 months that are laboratories, and this is something that's impacting them and really can ultimately impact the physician in the practice that's trying to bill for the tests. Now, one of the things that is coming up heavily on the lab side is that they have to have access to the documentation to support that medical necessity. So whether the lab's going to bill it and they're going to get paid for it, or the practice is going to bill it and get paid for it, it still comes down to the documentation from the provider and what they've gone over on that date of service. Now, one last thing I want to say about that, there's guidance out there from CMS, and Michelle, you had brought up the CGS documentation checklists, things like that for laboratories. CMS also has something out there as well related to compliance and documentation of lab services. And in the CMS document, they very specifically talk about not just what happens before testing with the intent, but what's going to happen after. So we're not talking about situations where a provider can just order a test and then that be it, walk away from the patient, never see them again. There has to be documentation also showing what they're going to do with those results. So, Michelle, why don't you start by talking some about that CGS document? For the coders and auditors listening, this is something, remember that a lot of the MACs and the carriers for the different regions and states will have different resources available that we can look at as an audit tool. Or if you're coding and you're not sure if you're seeing everything you need, these are often on the websites of the MACs. So even if you don't see it with yours, look around at some of the other ones and see if that's going to help you in the work that you're doing, or maybe even the message you're trying to relay to the providers you work with.
Yes, I think that's a very good point about looking around at the other Macs and what they have to offer. Because as I was looking at the different Macs in preparation for today, I noticed a lot of them did not give the level of detail that CGS did. And I really liked this checklist tool that they have out there on their website for the labs because I think it provided a lot of clarity and it didn't leave anything up to question. So it starts out by talking about what should be done prior to any lab services that are ordered. And the very first thing is establishing medical necessity for those orders. So just like you just talked about. So what is the patient's diagnosis? And it says in here, I found it very interesting, and it's not just looking for the ICD-10 code, not just name of the diagnosis, but they're also saying that the reason must be clearly documented in the medical record. So I know physician educators and those of us who are coding and auditing and educate our providers, we sound like a broken record when we talk to them and telling them that we need to know their thought process. Simply documenting the thought process behind why they are ordering these labs would check all of these boxes very easily. And it's not something that has to be documented in this extensive paragraph. It can be a quick sentence that shows why the test is needed and what are they going to do with that information. So the second thing that they touch on after what is the patient diagnosis and clearly documenting the reason in the medical record for that test is what prompted that lab test, and they want documentation to show what are the treatment changes that are going to be made. This could be eliminating a medication altogether, adding a medication, switching a medication. One that comes to mind for me, that I see a lot of documentation in this manner is with patients' lipid panels, for example. Most providers I find do a pretty good job saying that they're why they're checking the lipid panels and what their plan is for that specific condition once the results are in. So they're looking for how are you going to use this information? So not only why do you need it, but how are you going to use this information in the treatment of the patient? And then it goes over, was the order signed by the physician or an eligible professional? So do we have a signed order from the provider?
Yeah, and this is something too. So as you're talking through this, I just start thinking of all these scenarios, and this is what can be difficult sometimes is there's so much that comes up and so much we could probably talk all day about this. It'd be really boring to other people potentially, but we could talk all day about it. And, one of the things that is not recognized, and I think from the patient side, they don't realize everything that goes into this either. Because if you think about the patient's perspective, if you're sitting in that office talking with your provider about the different tests that need to be done, a lot of times we're just worrying about, okay, is the paper given to us as an order? Now a lot of it's electronic, so they're not walking out with their requisition form in hand.
Yes.
But from that patient side, you're thinking, okay, I just need this order and then I'm going to go get my labs done. And there's a lot more that goes into that. And we saw a lot of issues in this area during the time of COVID because we had things like drive-through testing sites going on, walk-in clinics, different providers that pretty much just had setups to test, and that was about it. And for the patient side, if you're not aware of what it was like in the industry during that time, we had new information on a regular basis. So, at one point they may say, okay, yes, we'll cover COVID testing. And then that morphed over time into, no, you have to have an actual reason beside needing a positive or negative test for us to, reimburse this and all of that. I bring that up because that goes into the issue of documentation.
Yes.
There's so many times I'll do an audit, and some of this is at the fault of the way the EMR system is set up as well. And I say that because systems are set up with smart tools, but they don't understand the negative impact all the time from a compliance perspective. They're looking at workflow optimization from the provider perspective, but then it's hurting everything we're trying to do on the other side. And what I mean by that is there's different EMRs I've worked with, and when I go to audit, I look at the orders and the actual E&M progress note shows me, okay, these 3 diagnoses are the reason for the order, but yet the system in the order module let them select the 20 diagnoses they've had over the past 2 years, and all of those are on the order, which means that's either going to the internal lab staff or maybe even externally to an outside lab, which is very problematic. So I think it's really important where you stated, we've got to have the very clear understanding of what's going on, and then bringing that full circle to, see, okay, what are they going to do with that? So it's not just screening. Um, I think another thing, Michelle, that's important to understand too, maybe even more so from the patient side, is the differences with the type of testing. So we have what we would refer to as the rapid testing. So that's going
Mhm.
to most commonly be things like the urinalysis, so the dipstick when you're peeing into that cup, which is always so fun. And then our rapid tests like a strep test, COVID, flu, all of that. But in each of these areas, there's also the option of the cultures. So do you want to speak a little bit about that, and what that type of conversation would look like with a provider when they're talking about sending labs out, different things like that?
So I think the most important thing starts before you even go to your doctor's appointment. Know I know we talked a lot in our first about know what your coverage is. Know what your policies state. That really helps you when you go to the doctor's office. It helps you to know to ask questions. It can also help you to know and anticipate some of what they may be ordering. So I really think from the patient perspective, that starts before you even go to your doctor's appointment. And that is having a good idea of what your insurance coverage is and what it pays for and what your responsibility would be. Because a lot of times when things are diagnostic or therapeutic, we're talking about outside of preventive services, there is going to be some type of copay or out of pocket expense for you as the patient associated with that testing. And it's important to know and anticipate what that's going to be. I know for me, I would rather know ahead of time what I'm going to have to owe than go through all of my testing and get this bill at the end of the day and be surprised when I could have taken the time to review my policy and determine what my coverage is going to be. I know at the beginning of the year, a lot of us receive a summary from our employers that tell us what's covered, what the copay and such is. So it's really important to be reviewing that information. And then also ask questions of your provider to get more clarity if there's anything that you're not sure on once you're in that visit. And most hospital systems, I don't know if you've experienced this, Stephanie, but they have a way to go in there, review the physician's documentation from that visit, and give you an estimate. Now, I use the word estimate because it is an estimate. Sometimes things change when you're going in and doing testing and getting these things done, where something different might have to be billed based upon what is supported and such. But I would always recommend getting those estimates and allowing them to provide you with that information based on what is documented. And they typically work right along with your insurance company from my experience. So they get with the staff from the facility will get with the coding professionals. They'll see what would be coded, and then they get with your insurance to then also get an estimate for what these tests are going to cost you. And I've seen everything from labs, routine labs that were being ordered, all the way up to extensive surgeries and medical treatments as part of these estimates. So I don't think anything is too small or too large to be given an estimate on. But know what those resources are that are available to you, know what is covered under your insurance, or have a general idea of what your policy is, and then ask questions and use those resources that they have available to you to get things like estimates and such.
Yeah, and I want to take a step back here to explain the difference between diagnostic and therapeutic. So, when we're talking diagnostic, this is more so what patients are familiar with as your preventative medicine. So, diagnostic means that there's not a known issue at this point. You've not come with active symptoms. You don't have a diagnosed condition. There are labs or I say labs because usually this happens in the lab space, but this can happen as well when we look at radiology. So, different mammograms, colonoscopies, that's considered a diagnostic procedure if that's being done for screening purposes. So, it's that unknown. They're looking to see if there's a problem. We don't know that's a problem. That would be diagnostic testing and or procedures. When we use the term therapeutic, that is referring to requiring treatment. So if there is the therapeutic portion to that, they know, like you had mentioned, the lipids, Michelle, at that point, they know there's a problem. They're looking to gauge, okay, where is this at? Is the patient stable? Is the treatment working? Are they progressing? Is it getting worse? Do we need to consider different treatment? That's the type of questions that would come into play with therapeutic testing or procedures. So the two perspectives when you're looking at your policy, for example, that's when you'll go in, like Michelle's saying, with the preventative side, you can look into that. And then also just general coverage for the services if you require that for therapeutic purposes. Now, one other thing to cover with this is related to what the actual testing is going to look like. And one other thing, actually, before I get into that, I want to say something from the perspective of the coders and auditors. Remember that when we talk about diagnostic versus therapeutic, we are not just adding diagnoses based on a patient's known coverage. So if the provider, for example, is documenting some symptoms, but you know that one particular condition is always covered for that lab service, you can absolutely not just slap that on. If the provider's telling you that, they're completely in the wrong. Do not do it, because to some extent you are taking on risk yourself if you're pushing stuff out the door that you're fully aware is not supported. So there should never ever be, when I walk into a practice or if I'm helping someone virtually, remotely, and we're talking about different type of tests and they refer to a particular tip sheet they have, and the tip sheet says, procedure, diagnosis, all of these things. Absolutely not. That has to come from documentation. You cannot just pick and choose what you know is covered from a payer and use that across the board for every patient. That's going to become a
Mhm.
very large issue. And so one of the things I wanted to go over that I started to say was specific to what happens at the time of testing. So Michelle, I went through this I think about a year and a half ago with one of my girls. We went in for testing, and the initial tests are not showing anything, ultrasounds are not showing anything, and then all of a sudden they're like, okay, we want to do more extensive lab testing. Okay, sounds great. Issues are still happening. We still have no answers. Let's do lab testing. Now, this particular group had, I think it was Quest Diagnostics or one of them, an external lab inside their practice. They had a phlebotomy room, so the blood draw room, and that staff member worked for the external lab, and the labs were run by that outside company. It was not associated with the practice. I was not informed about any of that. From a coverage perspective, the tests ended up being over $3,000 just
Mhm.
for laboratory testing. And, I get it. It's a different entity. That physician was probably thinking it's the lab staff who are responsible to explain all of this to me. But if this is the setup of the practice, I think it's important, and that provider and that practice still has some responsibility outside of just saying, oh, this is going to be billed by somebody else.
Yes, I agree, and I think that a lot of times what I'm hearing from providers is they don't want to have these discussions with their patients because they can sometimes be confusing. It's it's not really known right then and there what the coverage is. So it takes a little bit more than usually than just saying, "Hey, there's probably going to be additional charges for this. And I think a lot of times from the patient perspective, you're in these situations, like you said, you're there, the point of care testing wasn't revealing anything. They were recommending getting this additional testing. Sometimes you feel a sense of urgency. You definitely need to figure out what is going on medically, but sometimes you can take a step back and ask those additional questions. What are these tests going to show you? Why do I need to have this testing done? What is the purpose of it? What are we looking for here? And get those specific answers. And I think if you can get those answers, which those definitely should be able to be answered for you by your provider, better so than, in my opinion, how much is this going to cost me? um, you can make a more informed decision about going on over to that lab and getting that lab work done, because I think to the average consumer, you're not going to know that this lab is run by Quest Diagnostics usually until you get your bill from Quest Diagnostics, and then you'll be like, well, geez, they were in my doctor's office, and there's all of that confusion. So even just by simply asking, what are we looking for with these test results, can give you that little bit more information and get some insight into what the value of these tests are for your overall health and determining what is wrong in that particular day.
Well, and that's something I found interesting working more closely with laboratories is that, in their claims process, when they're trying to get paid, this is more so not if the patient is, having the blood draw in the office. This happens a lot more when it's sent out. So the sample, the
Mhm.
specimen, it's all sent out. This can happen with cultures, blood draws, different things like that. But from the lab perspective, that's very frustrating too, because the provider orders something, patient doesn't know, provider's not checking, they, wash their hands of it, it's going out to a lab. And then the lab has the claim processed and it says, okay, we're not going to reimburse you, you're out of network. They should have used an in network lab. Well, at what point in this process is anybody going to be paying attention to that? And I
Yes.
don't think we have an answer or a solution because we know that practices, are hurting right now from a staffing perspective. Things like this really take a lot of work. And, last week in the episode, Michelle, we talked about the fact that reviewing things like prior authorizations and insurance verification is more so of a courtesy. It's not something the provider's required to do necessarily. It helps their
Mhm.
revenue. So in situations like this with labs, when they know they're not even billing for that, they may not be paying attention to what's going on, which can either hurt the lab where they're going to lose money, or you're going to have customer satisfaction issues because they're not going to understand why this is happening either.
Yeah, and I think that, like you said, there really isn't a good answer to how to fix this other than just once again going back to the consumer and saying, be informed, know know what questions to ask. And it's okay to say, I need to make sure that this pharmacy is in, or this lab, sorry, is in network, or even pharmacy. It could apply to that as well. Just like you would do that if you were being referred to another specialist, you would take that extra step, make sure that they're within your network and covered, and so on and so forth. So I think sometimes some of the problem is in the sense of urgency that you feel. And there certainly is situations where there is a sense of urgency. I don't want to say that it's always appropriate from the patient side to say, oh, I need some time, because sometimes things
Maybe
are an
not in the
emergency.
ER.
Yeah, sometimes things really are an emergency. So you really don't have time to say, well, let me call my insurance, I would like an estimate. It's no, we need to do this. We need to do this now because urgent intervention may be necessary as far as what they're looking for and the findings of these lab results. So keep that in mind as well. But if we're talking about day-to-day lab testing where something's being worked up. The workup so far has not been revealing. They want to go to that next step of testing. It is okay to say, I need to take a day to figure out if this is covered. Make sure you're going to the appropriate facilities for the testing and have that make that informed decision for yourself as far as getting that testing done.
And, one thing that really is a pet peeve of mine, and I see this as a frustration on the patient side, is when there are issues. So when this entire process goes wrong, it usually is a situation like a patient going in thinking they're receiving something preventative, meaning again, they're looking, we don't know any symptoms or active issues or conditions. So they think they're going in for preventative, but then everything's processed out. It's actually underneath a condition or a problem of some sort. And now all of the out of pockets apply that wouldn't be there if it was preventative. And I can't tell you how many times I have either talked to staff who are frustrated in the offices, to friends and family that are asking advice about different bills
Mm-hmm.
that they have. And, every time, I shouldn't say every time, most of the time, the feedback I'm hearing is that if that patient, for example, calls their payer to question that bill when they scheduled for preventative, the payer's not giving a lot of information and they really won't. And they'll just tell them your provider coded it wrong. So
Mm-hmm.
then the patient's mad at the practice because they think that the provider coded it wrong and just want it changed. But as we said a little bit ago, it's not a matter of just changing over a diagnosis on a claim to get it paid.
Yes.
We have to have documentation showing that that's the case.
Yes. And I think that we could probably spend several hours talking about that topic of, preventive versus therapeutic. And you gave those definitions earlier. But I think that sometimes what is happening is you go into your provider and you're saying that you're having this symptom. And there is a preventive test associated with it. So the provider's like, well, we can just order this preventive test. However, that symptom is also documented in their note. So from the coding perspective, like you said, Stephanie, we should never just be adding a diagnosis because we know that's what's going to get it covered for the patient. But also from the patient perspective, know that if you're going in there with a symptom or a problem that needs to be worked up, it's probably not going to fall under your preventive coverage and you're going to have out of pocket expense for that, regardless of what the provider is saying, because it's just not correct. And if it's documented according to what you presented with, the insurance company will likely see that or request documentation. If they request documentation, see, oh, this patient came in for a problem visit. They're working up a problem the patient has. So this does not fall under preventive. And
Yeah,
then
and
results in that cost
mhm,
to the patient.
yeah. This is reminding me of a video I saw recently. And, honestly, this is some of why I really wanted to pursue the idea of this podcast, because I'm seeing more and more out there on social media, not as much from the news, but just individual people putting content out there where they're realizing something about the health system that's always been there, but they're talking about it like it's this new thing, like it's this new issue with the physician they're seeing or whatever it may be. And that's not the case. This has always existed. People just
Hmm.
have not always been paying attention, or they don't have a way to find out how to connect everything like we're trying to do here. And with this one particular video I was watching, this woman was, on a soapbox and completely outraged because she presented to her practice and she was there for what she thought was a physical. And this
Hmm.
was, I believe it was a GYN. So she was there for her annual pap smear and pelvic and breast exam, all of that. So she at the front desk, and I actually liked that the front desk brought this up because we don't always see this as, a preventative approach to patient education. At the desk, they had a conversation with her about the fact that it was a preventative visit. If she did have any current symptoms or issues she wanted to bring up with her practitioner, it was fine, but there could be additional charges. So to me, I'm like, perfect. That's like A status, gold
Yeah.
star for the practice. And the woman's here ranting about how unfair it is that she can't even just go and have a conversation with her provider without being charged. And I'm thinking to myself, this is also what's so frustrating in the industry because it's not the providers that are the problem. A
Mhm.
lot of times it's the problem with the structure of the payer side of thing. There's policies in place. You have coverage. It's an agreement between you and your insurance plan, which the provider then has to accept if they're going to participate. So it's not a provider issue. The practice
Yeah.
was doing exactly what they needed to do. And, there's so many times too, to your point earlier, that the providers are worried about what it's going to look like to them. It's not their fault, but they're worried about it. They
Yeah.
have a right to be paid for the work that they're doing. And that's a part of what happens with this. So if you go in for preventative, but you also have existing conditions, yes, they may order that testing for you, but it doesn't mean because you scheduled preventative that that's the way the claim's going to work out at the end of the day. And that happens a lot, even with
Yeah.
mammograms. We see that a
Yes.
lot, especially with GYN.
Yeah. And I think that's a common misconception about our annual physical exam, our preventive exam that we go to yearly with our doctor. And it's important to know the difference between a preventive exam and an annual follow up of your chronic conditions or being seen for a problem. Those are very different services that the provider offers. They are different areas, even though to the everyday consumer, they may seem to be all the same thing. Just know that they are very different things that your provider is doing. And they do deserve to be paid for the work that they're doing. To speak a little bit to the videos that we see on social media, I think a lot of that has led to demonizing healthcare. And sometimes it causes people to say, well, I don't want to get a bill for this. I can't pay for this. I'm not going to the doctor. And I don't think that's the solution either. I think being informed, knowing knowing what your coverage is, going in there being informed about what it's going to cost you really helps you know and gives you a little bit more confidence, and allow your provider to do their job of treating you. Their expertise is taking care of your medical conditions. Their expertise is generally not your insurance coverage. So know what your coverage is, know what your resources are, understand that not when you go in for a preventive exam, everything that day may not fall under the umbrella of your physical exam. And having that knowledge of what is covered will give you a better idea of what's involved in your preventive exam. Unfortunately, not every practice does what that one example that Stephanie gave was. That was like an outstanding example of what we wish would happen every time. We wish that when you went to go check in for your physical exam, that they would let you know that there's potentially going to be a charge for today's visit if you want to discuss things outside of what's in your preventive exam. That would be great from the coding perspective, the office workflow perspective, if people would institute those types of workflows, because I think it would also spark that conversation more between patient and provider about asking the questions about what's being ordered and bring a little bit awareness up front. It may be frustrating to the patient. Sometimes we can't control people's responses to the information that we're giving them, but we can give that information to them up front instead of then having to take that phone call after the fact saying, well, why didn't you tell me? Because that's exactly what they're going to say when they get that bill in the mail and call you up with, why am I being charged for this visit when it was my yearly exam? And then you have to go through and explain to them, well, you needed to talk about this in addition to your preventive exam. This is not covered under your preventive exam and caused an additional charge. So I think if we could get more practices to implement that workflow into their patient visits, where up front the patient is told these things, then that would be great. And I'm not talking about just saying, just sign on this pad that you agree to care today. Because how many times have we been asked to sign on that mysterious pad with no clue what we are signing for, which is a whole different topic for a whole different day. But if they would just implement some of those practices and have those conversations on the front end instead of trying to play catch up on the back end, that would be so beneficial not only to the practice but also to the patient to initiate those conversations.
Yeah, I think those are great takeaways for the patients as well. And I just want to add for the last takeaways here for the practice, I urge you, when you are doing your audits, even if you don't have an internal lab, those orders and the way the documentation is matching up, that should all be a part of the review, even if you're not receiving that reimbursement for the lab test. Because what you're essentially doing is creating a mess for the next person that has to deal with the revenue of the labs and getting that billed out and all of those different things. So, it's one of those things where providers may be frustrated up front. But, there are some circumstances where I'm starting to see when there are elevated cases. So maybe, at the administrative level, the OIG, the DOJ, whoever it is, may be looking into different things. Payers, commercial payers are looking into different things. They are starting to go back and question the providers as well. So you
Mhm.
have to think about the practice's involvement in this mess. You need to take accountability. You need to clean that up. It has to be a part of the audits. We're not just reviewing records or just coding and sending out what we know is going to be paid. Another part of that, too, if you're responsible for the charge entry portion in your practice, I would ask, okay, are there different edits that are built in that don't even allow you to push a claim out if it's not a covered diagnosis? I
Mhm.
have dealt with that before, and I have a lot of compliance concerns around that, because if it's not in that provider's record, you have no business adding that diagnosis to get it to pass the system, to get it to pay for the patient the way that they want, any of those things. We've got to start with the provider, documentation, then go from there.
Mhm.
So, as always, I'm obviously, really advocating for external audits. It's what I do in my consulting firm. It's what you do in your career as well. It's
Yes.
important to have that outside feedback and communication, because these types of things need to be looked at. And when audits are done, you can't just focus in small little areas. You have to look at the whole picture. And this is one of those things that definitely can fall between the cracks if it's not addressed. Now, I just wanted to remind everybody real quick as we end for today that we do have an email address set up. So if you have any questions, you'd like to submit a topic you'd like us to cover, anything like that, feel free to send it over to our email. And we'll see you again next week. Thank you.
Thank you.